My name is Dr. Murali B.K. and you are exploring healthcare's future with Hope and Ayushman Hospital in Nagpur. In the modern era, electronic health records, or EHRs, play a pivotal role in digitalizing healthcare information, making it easily accessible and shareable among medical professionals. With about 80% of medical practices now using EHRs, the healthcare industry is eyeing artificial intelligence, or AI, to further evolve and optimize healthcare services. Imagine a doctor writes heart attack in a patient's record, while another uses the term myocardial infarction for a different patient, although they mean the same thing. Here's where natural language processing, or NLP, a branch of AI, steps in. It identifies these varying terms, matches them together, thus creating a more standardized and concise record. This not only helps in reducing any confusion, but also paves the way for analyzing larger data sets seamlessly. Doctors often have a lot to jot down, and sometimes they might repeat certain phrases. NLP also helps us by identifying these redundancies, keeping only the relevant information, making the reports easier and quicker to read. Now, let's talk about concept processing. When a doctor enters information about a patient's condition, AI can sift through the data to find similar cases. This could remind the doctor to include all necessary details and provide insights based on similar cases, enhancing the quality of care. Moving a step further, AI dives into predictive analysis. Through algorithms, it assesses a patient's record, considering past ailments and family history to predict potential health risks. It's like having a smart assistant that can foresee possible health issues based on a rich pool of data. Just like we follow a recipe to cook a meal, some AI algorithms follow a set of rules to analyze patient data. They sift through a vast amount of information, drawing connection between observations and diagnoses, helping to predict a patient's likelihood of developing certain conditions. This way, doctors get a heads up on potential issues, saving precious time and ensuring better patient care. With the power of AI, one study showcased a 72% accuracy in predicting treatment responses, a promising leap towards personalized healthcare. As the amount of online health records is doubling every 5 years, it's humanly impossible to manually sift through all this data. But with AI, this vast data becomes a valuable asset, assisting physicians in delivering better, informed, and timely care to their patients. The fusion of EHR and AI is not just a technological advancement, but a beacon of hope for enhanced and personalized healthcare, ensuring a healthier tomorrow for all. If you have any questions, please leave a comment below. Don't forget to subscribe and turn on notifications to stay updated on all our new videos. Additionally, visit modernmedicalentrepreneur.com, where you'll find our virtual fellowship course on AI in healthcare. Hope to see you there. Thanks for watching.